Ladies and gentlemen, thank you for joining us again. We now move on to the second plenary session this morning. We are indeed very honored to have a stellar panel to stimulate discussion on breaking silos in facing the challenges that we encounter in changing systems for planetary health. Ladies and gentlemen, will you allow me to now call upon our esteemed panelists. First of all, may I call upon Professor Emerita Datuk Dr. Asma Ismail, immediate past President, Academy of Sciences, Malaysia. Next, may I call upon Tan Sri Abdul Wahid Omar, Chairman, Bursa Malaysia Berhad. Bursa Malaysia is the Malaysian Stock Exchange. Also joining us this morning is Dr. Koki Takaki, who is the Director of the Office of Mercury and International Chemicals Management, Environmental Health Department, Ministry of the Environment, Japan. And may I now also invite Dr. Garry Aslanyan, Manager of Partnerships and Global Engagement, TDR, which is the special program for research and training in tropical diseases, the World Health Organization. Serving as moderator, we're indeed very privileged to have with us Professor Meera Sivasothy. Meera Sivasothy's dynamic career bridges business, media, and healthcare. Graduating with a Bachelor of Business in Accounting, she transitioned into broadcasting in 2008, joining Malaysia's BFM 89.9 radio station. With over a decade of experience, she's become a notable figure in Malaysian media, excelling in radio management, broadcasting, and presentation across various roles, including news, production, and hosting, notably leading the Health and Living segment on BFM 89.9. So, ladies and gentlemen, please welcome Professor Meera Sivasothy.
Thank you very much, Paul. Good morning, ladies and gentlemen. How are you today? After that first panel session, I'm just going to briefly pick up from there and kick off this next session. What did I take away from that? Well, we have tons of protocols, we have tons of conventions, we have tons of treaties, we have a lot of talk, we are regressing, and it is a matter of life and death. So question is, how do we fix this? What are some of the problems? We also know planetary health has challenges. The challenges are interconnected. Actions taken in one sector can have ripple effects on the others. So acquiring this buy-in across sectors can be a huge challenge. And that's probably why we have so much in place, and yet we are regressing when it comes to planetary health. Often due to the lack of understanding and awareness of the benefits of it, lack of coordinated approach, long-standing institutional structures which are in place which need to be broken down, and diverging priorities between sectors. So during this session, we are going to attempt to understand the what, the how, and the why. Breaking silos is the way towards changing, a change in planetary health. We have a slight different in our format today. We're going to kick off today's session with a short presentation before we embark into the conversation. But please rest assured, we're going to be taking questions as we go along. So don't wait till the end. You can put your questions through Slido. You can actually put up your hand and the mic runners will come to you and you can ask your questions from the floor as well. So kicking off today's session, please allow me to invite Dr. Koki Takaki, Director of the Office of Mercury and International Chemical Management, Chemical Safety Division, Environmental Health Department, from the Ministry of Environment, Japan, for his short presentation. Dr. Takaki.
Can you hear me? Okay. Yeah, thank you. Thank you so much for inviting me to this wonderful event, and I'm really excited to join you with a discussion about the planetary health concept. And also, I really appreciate the Sunway University and other organizers to hold a very big conference about planetary health. Thank you. Thank you for giving me a short moment to talk about the Japanese experience to tackle the environmental pollutions. So I would like to give you some presentation within 10 minutes, I hope. And following the slide. So let's begin. So environmental administration in Japan began with the response of severe pollutions, such as Minamata disease. The unchanging starting point of the Ministry of the Environment Japan is a mission of protecting human life and the environment. In considering planetary health, we would first like to look back at the history of environmental policies. Okay, so Japan experienced a rapid economic growth in 1950s and 60s, but it accompanied with serious pollution problems. The Japanese government then started to develop some regulations to control pollution at the first attempt, such as for water quality in public water bodies or regulate something. However, they are not effective enough to prevent such pollutions. And one of the main reasons was to prioritize the economic development. So as a result, these legal deficiencies did not prevent the spread of health hazards caused by pollution, which was a major point of depression for us. And this is an illustration table of the environmental administration. At the time, health measure at the regional level was covered by the Ministry of Health, but no ministry was in charge of environmental protection measures. In addition, there are not enough coordination between the Ministry of Health and Welfare and the ministries in charge of economic measures. So it should be also noted that only regional issues were focused then, and issues at global levels were not aware. So these structural deficiencies resulted in enormous health problems, unfortunately. This is called 4 big pollution diseases of Japan. As you know, Minamata disease and Niigata-Minamata disease were caused by methyl mercury pollution, and Itaita disease caused by cadmium pollution, and Yokkaichi asthma caused by air pollution. And following these pollution of diseases becoming the big social problem in Japan, various laws and regulations were enacted in 1960s and 70s. These laws deleted the economic harmonization provisions from the previous laws and expanded the regulation areas to cover the entire country. And finally, in 1971, the Environmental Agency, which is currently called the Ministry of the Environment, my organization, was established to centralize the environmental administration, which had been vertically divided among various ministries. So this is the starting point of our environmental administration in Japan. And here is again the illustrative diagram of the environmental administration after the Environmental Agency launched. The Environmental Agency has filled with the administrative gap in the regional environmental issues and taken the function of overall coordination among economic, health, and environmental administration. And since the establishment of the Environmental Agency, environmental protection measures have been strengthened, resulting in the restoration of beautiful seas and blue skies, and health hazards caused by pollution have been brought under control. So this is the picture of Minamata Bay and Yokkaichi sceneries. So, but on the other hand, global environmental issues have increased in an invisible manner, such as the carbon dioxide emissions. And from around 1990, there was an increasing demand for cross-border cooperation in tackling those global environmental issues. In 1988, the IPCC was established to strengthen scientific knowledge on climate change, and also UNFCCC was launched. In line with this global trend, the Ministry of the Environment put global environmental protection measures positioned centered by establishing the new dedicated department and developing the basic law on the environment. Japan has also been actively addressing global environmental issues and the international cooperation. The table below shows a comparison of pollution and global environmental issues. In the local scale of pollution, the polluters and victims are usually different. The former is sometimes an industrial corporation, and the latter is a local resident. But when it comes to the global environmental issues, each of us is regarded as both polluters and victims. For we are all polluting the global environment in our daily lives. In addition, unlike pollution, it is difficult to visualize the situation of environmental pollution and health hazards. This character has made it difficult to be aware of global environmental crisis internationally and may have been getting the problem worse. So, as you know, so I would like to skip the background of Planetary Health to you, because you know much more than me. So, and it was launched in 2015, so there was a shared sense of urgency that, in my understanding, that the main concept is that global health and human health are interdependent, and that if global health is lost, human health is lost as well. That's a wonderful concept. And the health effects of climate change are wide-ranging, including heat stroke and heat-related death, death from natural disasters, and the spread of infectious diseases. The greatest crisis in environmental health in the past was pollution problems such as Minamata disease. But planetary health is the second environmental health crisis. The global environment must be made sustainable through the collective wisdom of all humankind, regardless of national borders. Then I am explaining an overview of the global warming situation in Japan. Like the other countries, the annual average temperature in Japan has been increasing quite rapidly at a rate of 1.35 degrees per century, and reached the highest record last year. The number of deaths due to heat stroke has been on the rise, with more than 1,000 people dying in the past few years. So considering this situation, the Ministry of the Environment passed a bill in the Diet last year to strengthen measures against heat stroke, and the bill has been in effect since April of this year. The concept planetary health has been incorporated into environmental administration. So descriptions on planetary health were added to the Japanese SDGs implementation guideline revised last year, and it was also added to the draft 6th Basic Environmental Plan, which is to be soonly approved by the Cabinet. Last year, the Ministry of the Environment took on the central role in the government in preventing heat stroke, and the climate change adaptation law was amended to include the countermeasure against heat stroke. So we will also strengthen efforts for local decarbonization. Last year, the Ministry of the Environment launched a national movement called Dekokatsu, which aims to achieve both local decarbonization and good quality of lives. In this national campaign, all citizens are encouraged to recognize climate change issues as their own personal concerns, and then the movement is to be expanded to the local, national, and global levels. The concept of planetary health may help all citizens to recognize the climate change issues as their own affair by using the keyword health. Although the climate change issue is a global scale problem, we believe that it is important to put one's own daily lives into the center of the countermeasures. So it may be necessary to address planetary health in cooperation with relevant government ministries at the national level and with other countries at the global level. In addition to cooperation at the global government ministry level, cooperation with various stakeholders, including industry and academic society, will also be required. In order to strengthen planetary health approach, environmental administration must be more extensive and dynamic than ever before. So Japan will continue to share with you the lessons learned from the pollution tragedy which Japan experienced, and then to collaboratively think about how we could move forward on the planetary health problem. So I'm very happy to discuss at this session. Thank you.
Thank you very much, Dr. Koki. Thank you. I'm going to kickstart this conversation with you, Dr. Koki, since it's still fresh in our heads. You know, Dr. Tan Sri Zakri in the previous session spoke about the lack of political will to make a change. What did Japan do to make planetary health a priority in the country?
Yeah, thank you. Yeah, I think one important point was, important event was heat stroke problems. Yeah, as I present in my presentations, heat stroke problems, become very severe in Japan, and people are aware of it. So that's maybe planetary health is a very conceptual, but when you could find the concept is related to the things in your daily lives, so people are more aware of that. So that's one reason we could move it forward to get planetary health into the Japanese policy measures.
So what you're saying is the situation has to become so dire that it affects me, and only then we start moving and we start doing something. I'm very, very proud because Malaysia is the first country in the world that is drafting or in the process of coming up with a national planetary health action plan for Malaysia. And we have Professor Asma, who's actually the chair for this national planetary health action plan. I was so absolutely proud yesterday on an international platform that we're going to be the first country to have an action plan. Professor Asma, I don't think she's having an easy time, but would you like to share that experience with us? What was the motivation? What got us wanting to come up with an action plan? What have been some of your challenges so far? We've not launched this yet. We're not ready with it yet. Okay.
Okay, first of all, thank you to Tan Sri Jamila and team for organizing this wonderful conference. And thank you to the organizers for inviting me also to share my thoughts on this topic. Basically, if you ask the question, is planetary health a top priority? If you compare that to everyday discussions like politics or economic crisis, probably, you know, my knee-jerk reaction will be no, not yet, right? But if you ask the Malaysian government, is planetary health a priority? The question just now, is it a top priority? Not yet, but is it a priority? Then the answer is yes, okay? I say this because, you know, Malaysia, we have 5-year plans. And in the 11th Malaysia Plan, which is 2015 to 2020, there was an emphasis on growth, on green growth by strengthening governance, conserving natural resources and taking care of climate change and natural disasters. But when you don't have somebody who owns it, someone who has now to make sure it happens, it doesn't take off very well. And then in the 12th Malaysia Plan, which is currently what we are facing, 2021-2025, The government continue to advance a green growth by having clean, a green, resilient development agenda, but this time, the government realized that it has to be a whole of Malaysia approach. It cannot be just ministry approach working in silo. So this is an agenda where what we are discussing today, breaking the silo. And so once we start to face that, the government is saying no more working in silo for the ministry. So planetary health now is mentioned as an important agenda to be looked into. But you know, when you talk about planetary health, it's very important that the people involved in the writing of these documents really understand the terminologies, because when we deep dive into the document, it talks about planetary health, but somewhere along the line, it just talks about the environment, and it doesn't connect that to human health. And so studies by Academy Science had shown that the EPI, Environmental Protection Index for Malaysia, had gone downhill, and that we were making essentially economic progress at the expense of social and environmental impact. So basically we realize that we need to take care of the environment, since the cost of not doing anything about it is in the billions in Malaysia. In fact, it's taking up about 3% of the GDP of our country. So at Academy Science, we realize therefore there is an urgent call to action. And we need therefore to take care of planetary health, and we need to have an integrated action plan that is evidence-based, because if it's not evidence-based, you cannot convince a lot of people, you can't convince the business group, you can't convince the agencies, you can't convince the people themselves. So it has to be evidence-based, and we need to show via evidence that human health is interdependent with the health of the planet, because what we need to bring down to the ground is that what we do to the planet will bounce back to affect our health. So the National Science Council then had given the mandate to Academy Science in collaboration with all the central agencies and relevant ministries to actually develop an integrated national planetary health action plan that is humanity-centric, not human-centric, humanity-centric. That means not only just about the human, but actually human taking care of its interconnectivity with the environment. So we considered it to be humanity-centric, STI-enabled, nature-based, and values-infused. So in short, we hope to be able to deliver a planetary health action plan that addresses both the local and global challenges, while we prioritize humanity, well-being, sustainability, economy, as well as respect for the natural world. So the development of this National Planetary Health Action Plan is work in progress, and is due to completion in July 2024. So we are still working on it. The government gave us 1 year to work on this. And as I said, it is evidence-based and mission-oriented, meaning to say the solution or the action plan that we're going to give to the government has to be solution-based, and it has to take an all of Malaysia approach to ensure that the health of our people, the biodiversity, and the planet. So with an all of Malaysia approach, we hope to hopefully break the silos and work together, since planetary health is cross-cutting. So the emphasis will now be on transdisciplinary, multidisciplinary collaboration, which includes research, and there must be ethics, there must be values. We can consider values as part and parcel of faith or spirituality. There must be community empowerment, and being humanity-centric, STI-enabled, and values-infused in addressing all these issues. And we need to ensure that our solution or future proposed any solutions that we do as far as business is concerned or research is concerned has to be planet-friendly, because we believe that the turnkey to making all this plan work is basically governance, education, balance between business and planetary health, and communication and behavioral change. We need, when we approach Planetary Health Action Plan for Malaysia, it has to be systems approach, no longer linear thinking. So this is where we now say, so that they can understand the connectivity between human health and the health of the planet and everything in it. So, and we also need to understand that when we provide this action plan, science knowledge is not the only knowledge system. And we need now to make sure that we understand there are other knowledge systems involved as well, which includes indigenous knowledge, spirituality, all that before has been marginalized. So the National Planetary Health Action Plan, we hope to provide a framework, and we are now at the stage of finding evidence to find out what is it the people on the ground is thinking, what is the firms are thinking. Once we have all this, we will put together the indicators that is needed for an impact tracking system, because we need to now know whatever intervention that we have done, is it working? Are we seeing the kind of outcome that we want to do? So we are doing an impact tracking system for this, and hopefully monitor the outcomes of the implementation of the plan. So with the action plan in place, we hope by then planetary health will not just be a priority, but become a top priority for the country. Ladies and gentlemen, we know we still have a long way, but it's better to start now than not to start at all.
Okay. We would... July. You know, Professor Asma spoke about business a lot, and I don't know whether you would agree with me, but I think capitalism has a huge role to play in the way the state the planet is in today. So, Tan Sri Wahid, are you concerned at all? I mean, at this plan, how is that going to affect business? How is that going to inform corporate strategy when it comes to planetary health? I mean, the business sector is a huge contributor.
Well, thank you, Prof. Meera. Let me begin by thanking Dr. Jamila and the team at Soundwave for inviting me to be here this morning. Now, I come from the corporate sector, and I used to be a banker before. And as bankers, we have always been accused of financing projects that damage the environment. So that's why 5 years ago, when I was invited to join the board of trustees of WWF in Malaysia, I volunteered because I thought that that's time for redemption for me. So that's on the personal side. But corporates, as you know, we are quite clinical in our approach. Now, I think this concept of planetary health is new to us. And I think in order to make it work, there are a number of things that we need to make sure that we put in place. I think number one, there's a need for comprehension. Without comprehension, people will just do things as they go along and more informed rather than substance. So that's when you have issues like greenwashing and so on. So within the context of the broader context of sustainability, I think we need to be very clear how planetary health fits in within the context of the 17 UN SDGs, within the 3 elements of ESG, environmental, social, and governance, how it fits in within climate change and biodiversity laws. So I think you need to be clear on that. Now, I don't think you need to worry about corporates. I think generally they are responsible if they comprehend the issue. So, for example, when it comes to sustainability, corporates have already embraced sustainability in their business strategies and in their business operations. And not just because in Malaysia, for example, we have the Malaysian Code on Corporate Governance that required companies to embed sustainability in their strategy and in their business operations. But it's a matter of survival, because if you don't embrace sustainability, you're not going to get financing, you're not going to get people to work for you, you're not going to get people to buy your products, you can't be part of the global supply chain. So they are already embracing sustainability. And it comes with a lot of complexity in terms of the sustainability reporting framework and so on. So this is where there's a need beyond comprehension. It's about sequencing. So how do you sequencing it? How do you sequence it? So today, so for public listed companies, for example, those companies that are listed on our Bursa Malaysia, They are required to comply with the sustainability reporting framework for the main board, main market companies from this financial year, and for the smaller East market companies from the next financial year, for example. So they are given time to actually comply, and they are doing it already. Now, this framework is largely based on the Task Force for Climate-Related Financial Disclosures, TCFD. Currently, there's moved towards TNFD, Task Force for Nature-Related Financial Disclosures. So those are things that they need to comply with. Now we're going to load on them planetary health. So again, you need to be clear how you shouldn't be introducing new things. So see how they can interact and interface with each other. So for example, when I look at the 9 planetary boundaries that we talk about, actually 4 of them would fall under one category, climate change. So why? So you need to actually interact it. So as opposed to talk about 3 and then you have 9, so map it properly so that it becomes clear for them. They comprehend better, then they can sequence it better. And I can assure you, once that's done, it will be driven at the national level and at the business level, including authorities, and at the corporate and societal level. So I'm quite confident on that.
Yeah.
Thank you.
Did Japan have that problem?
Yeah, that's quite interesting point. And yes, now we are addressing to accomplish the target of SDGs goal, and we also have some other cross-cutting concept like a planetary health. And now we are in success to include the planetary health concept in our basic national environment plan to be soon be adopted by the cabinet. So, but yes, I think sometimes each concept, the terminologies are different, but the target and the goals are sometimes, many cases are same. So maybe we need to have more dialogue with other communities, which have different terminologies, and take any collaboration about to going to the same goal and the targets. That could be important thing.
Okay. Garry, you manage international stakeholders, research especially, implementation of research. What is your take on these terminologies? Because we have acronyms, we have, as I said, so many, it's confusing as Tansri said. I mean, I think for outside of this community here, a lot of us get confused. How do you deal with that?
Right, so I mean, obviously there isn't one solution to that, and increasingly people are going to try and explain things in different ways. We also forget sometimes the issue that, sure, we speak English here, but English is basically a language that is foreign to 80% of the world. So people need to explain this in their own languages, and sometimes these things don't translate immediately in the same way. And we forget that, and we try to basically translate and throw it there, or they try to translate into their own language. So language is always going to be complicated. But if you really come back to this issue of silos and how to prioritize and how to manage these kinds of stakeholder processes, what I heard so far, and what probably you all know, is probably a lot of that is going back to sort of being political and political role of politics and role of how the response to certain things is again going to be driven by political process. So we shouldn't forget that, and we should realize where. And this is very hard to generalize to the world, because the political process in different countries is very different as well. So always keeping that in mind. I'll give you an example, like TDR worked with India, Bangladesh, Nepal on the elimination of visceral leishmaniasis. And very complex issues. It's not like we didn't have a health solution to it, but sort of eliminate a disease takes a long time. And the only reason that 3 countries kind of were doing it together, or finish line for Bangladesh in the last 12 months, was because they signed that things among themselves and they wanted to compete with each other and show that we've done it and why didn't you do it and where you're behind and let's do it, get there. Now, that worked in that little microcosm of influencing 3 countries and seeing that the other one eliminated and the other one is on the way to eliminate, let's get there. So the political came into there, so the next time they meet, they can say they've achieved it, right? So there's a little bit of that aspect as well. Now, another kind of thought came to my mind as we were thinking about this is a lot of things can be written, but how will they be done, right? So we heard some of this, implementation and the silos. We need to learn maybe from different sectors or different other places as well for this. What I thought of is the earthquake not very far from here in Taiwan a couple of weeks ago. So imagine the planning they should have had and the multi-layer, multi-sector involvement in the last 25 years after the last one, where within 48 hours, everything went back to normal. Only 7 people died, mainly not from actually being stuck under the rubble. And in 48 hours, everything went back to normal. So imagine the system that was put into place and different sectors had to be involved to plan for that kind of change in the last 25 years, so they were ready for this. So what can we learn from implementation? In this case is basically planning for a disaster, right? Well, this is kind of a disaster we're talking about here.
Yes, it's a matter of life and death.
Right, so yeah. I'm not suggesting it's easy, but we probably can learn from those examples and see how these different sectors come together.
Dr. Takaki, what were some of the challenges in Japan when it came to, I mean, you've come quite a long way in terms of from just 2 ministries to, inter-ministry. You've got Ministry of Health on board now, you've got Ministry of Environment and all of them. What were some of the challenges for you in breaking down those silos?
Yes, so I would like to introduce one example to respond to your questions. Yeah, it's a very recent example. As I explained, Japan had just amended the law of the climate change adaptation, including the countermeasure to the heat stroke. And so why we could be in success in revising this law, and so the main point is that there is a big the cabinet initiatives from the policy side. The cabinet launched a very central meeting, gathering all the ministries, and also Japanese Minister of the Environment is chairing the central meeting and discussing about how to tackle the severe heat stroke problems. So that's kind of breaking silos process to using the government or policy initiative to gather all the relevant ministries. Okay. That's one example.
Sure. Prof. Asma, Garry spoke about a lot of words. A National Health Action Plan, Planetary Health Action Plan will be a lot of words. How will you foresee, or do you foresee challenges when it comes to implementation? How will you get Tan Sri Wahid to buy in to this? He's already said comprehension is key, sequencing is important. How will you do that?
Basically, I see this as an interplay of many aspects that needs to be put together. The turnkey to mindset change is education. I think we have not discussed about education when we are discussing this topic. If you see, the Malaysian education system, with the exception of a few universities, and it's not yet the curriculum. So the curriculum for planetary health needs to be introduced in the schools. needs to be introduced in the secondary education and also in the tertiary education. Once we have that, then we are going to have a population that actually understand what this is all about and do not see planetary health as another burden that you need to take care of. So this would be au natural to understand why the human health is very much dependent on the health of the planet. So it would be natural, but that means that we need to have education in place to change the mindset of the people. But then again, you need to also, once this mindset change can be changed, even if we have, we need to have the policies, the governance that needs to be in place as well. Because, you know, a lot of people right now, they are aware, they are concerned, but action-wise, they're not doing anything about it, right? Like your example is preparedness for disaster. So that is understanding, that's being resilient and understanding what needs to be done. But there is also a need for us to understand that behavior pattern needs to change. So education is turnkey, yes, but governance also needs to be in place because, you know, right now, all of us are into healthy food. We are drinking oat milk, soybean milk, and whatever. But it's expensive. It is expensive. So basically, if you now want to inculcate planetary health, good health, healthy lifestyle, this should be made available to all and not just the rich that can afford. And that's because the governance is not there to now make sure all this is less sugar, all that can now be made more available. But the thing is, Tan Sri Wahid is talking about Bursa, talking about MNCs and GLCs. But let's talk about the Makcik Kiah on the road. Can she afford to undergo ESG? So these are the kind of things that I think you need to also talk about equity. Can now planetary health, to me, planetary health is something that everybody must get involved. Doesn't matter the big business, the small business, the people on the street, everybody needs to get involved. So that's why I say that the turnkey to mindset change is education. But at the end of the day, if you want to break down the silos and whatnot, there is a need for leadership and political will. If you have the leadership and the political will to make sure that all of us must work together, as what the Japanese government are doing, I think we stand a good chance of having to move this planetary health agenda to become a top priority.
Do you think we'll be able to achieve that?
Yes, I'm confident that if we now start and communicate well to the people so that they can now understand it better. I think the way we communicate, we need to, of course, provide the kind of evidence that people would want to hear. Why should I need to change? Like you're saying, the business, right? You're saying that planetary health now is another added thing on top of ESG. But the thing is, it has the same end game to be able to have sustainability. So this is where I say that it shouldn't be seen as a burden if we are all with the understanding, common understanding, shared values and shared vision, it will not be a burden. It will be something that is au natural for us to now do because our health is very much interdependent on the health of the planet.
Yeah, I'm very proud to say that Professor Asma was Malaysia's first female Director General of Ministry of Higher Education. We'll need her back to change something when it comes to awareness and education. Tan Sri Wahid, what do you have to say in response to Professor Asma?
Well, thank you, Prof. Going back to the theme of this panel, it's about breaking the silos and enhancing collaboration. I would like to encourage all of us to learn from the experience of climate change, how we dealt with it. So for years, we've been talking about climate change from the Paris Agreement and so on. But leading up to the COP26 in Glasgow, there were concerns whether Malaysia would make that commitment to be net zero by mid-century, by 2050 or 2060. So we had a lot of discussions, but there was no indication from the government that government was about to do that. Then the whole society, I would say, the corporates, in the case of WWF, we took the initiative to undertake a study, to look at the possible pathways for Malaysia to achieve net zero by mid-century. We collaborated with BCG and so on. We then engaged a lot with the government. And at the point in time, we had Datuk Zaini, who was the KSU of that ministry, who was very engaging. So I think through those collaborative efforts, with enough facts and studies undertaken, it gave the government the courage to make the commitment such that when the Prime Minister tabled the 12th Malaysia Plan in Parliament, he also made the commitment that Malaysia will be a net zero greenhouse gas emissions nation as early as 2050. Now, how to get there? There's a series of things to be undertaken, and the most recent one being, among others, the National Energy Transition Roadmap, NETR, which provided a clear plan how we can decarbonize the energy sector, among others. Now, beyond that, at the business level, we have collaborative efforts among the businesses. So there is the CEO Action Network among all the CEOs to collaborate how can we learn from each other to address the issue of sustainability and in particular climate change. The authorities, there's a joint committee on climate change between jointly chaired by the Securities Commission and Bank Negara Malaysia, the central bank, right? Again, that's where we have the collaborative effort. And then we talk about the UN SDGs. So for Malaysia, make no mistake, when it comes to the primary responsibility to meet the SDG goals, would rest with the government, and the bulk of it would come from the national budget. But the government also recognized the fact that there will be cases where there could be communities that may not be sufficiently addressed. And that's where the government set up the My SDG Foundation, which was seeded with an initial grant by the government to work with the United Nations agencies. Ms. Karma was a big part of that. And the idea is actually, with that initial funding, collaborating with UN agencies and the private sector, corporate sector, will then identify, are there communities that may have been left behind? So people like the refugees, for example, the stateless people, urban poor, and so on. So again, this is actually where we can see with enough efforts, clarity of the objectives and so on, we can actually get various parties to collaborate with each other. And of course, the CSO SDG Alliance is also there to collaborate with the government and each other towards meeting the goals.
Do you want to share a little bit about bureaucracies in place within these organizations?
Well, bureaucracies exist in any large organizations, even in the corporate sector. The three groups that I used to mention before, they do exist. But I think it's important for us to be clear about the objectives and the action plans and assign the appropriate accountability. So who's supposed to do what, by when, and what is this expected outcome? When you are clear on that, with that clear objective, I think whatever bureaucracies that may be put in place can be overcome by the overall need or drive to achieve the objective. I think within the context of the spirit and intention of what you want to achieve.
Okay. Bureaucracies and delays, Garry. TDR is a host is WHO. How have you dealt with bureaucracies, which, it translates to a whole lot of delays, a whole lot of, what comes along with bureaucracies. What's that experience been like?
Oh, okay. Well, this is a good question. Well, I mean, inadvertently, when you have, I used to work for the Canadian government, and we had 10 provinces, well, still have, and 3 territories. So now, and I work for a federal agency. So that was already a nightmare that way when you have a decentralized health system. So when I moved to Geneva to work for WHO, that number went from 13 to 194. Obviously, at TDR, we don't deal with all 194. We deal maybe with 30. But still, it's complex. But in a way, the sort of global kind of multilateral system can also help bureaucracies to do things faster, and also the countries can sort of push the multilateral organizations do things faster as they own them. So I would say that there are a lot of obviously complex situations where you'll have to consider sort of the process and bureaucracies comes into place. But for what we are able to achieve, I think still multilateral system has achieved quite a lot. We just sometimes forget about that, and we don't maybe think of it right away, because most of what we do, if it only gets exposed if it fails, if it actually is working, and it's not only health or environment. Like if you look at ITU, which is the Telecommunications Union, which everything is in your phone, is negotiated in Geneva. You just don't know about it, right? And every single part, how it works and how globally these things connect and how countries agree to do that and all of that. So in a way, it takes time, but it can happen. It just depends what issue and how fast.
Yeah.
I think that's my take on it.
Prof. Asma, the financial architecture was discussed just in the panel before this. Do we need more funding for planetary health?
I think at
And
the end,
is the money ever enough?
the money is, of course, never enough,
Okay.
right? Yes, funding is needed in order to turn around. But like I said, you know, there are nature-based solutions that we haven't even delved into, because we're all thinking about the kind of science and technology that we need to now have. But it's also about science and learning about nature-based solutions that need to be put in place. And that probably will not cost a lot of money, but it makes a change. As we have seen, I think, I'm not sure whether all of you have seen the Tagal system in Sabah, how the river was protected and the fish there's a lot of fish and all that. And what happens there is that the indigenous knowledge comes into play, and the ministries and the governments involved actually facilitated rather than interfere, and you see the kind of outcome. So I think if funding is always necessary, but I think it's very important that the ministries work together, what I call a handshake mechanism, that there is a inter-ministry coordination body or some sort that now discusses about research from end to end, from idea all the way to innovation and all the way to entrepreneurship, as well as setting up the companies and the startups and all that. So that these ideas now must make sure it is planet friendly. So once we invest into all of these kind of things, then I think it's easy also for the companies to now be able to do sustainable stuff. Because the R&D that is done is also making sure innovations today, innovations in the future are all planet friendly.
Okay. Does anyone have a question? We don't seem to have questions on Slido either. No one? Absolutely nobody. No one. Okay. We have some powerful people on stage. Yes. Can we have a mic over there, please? Right over here.
Thank you. That was a wonderful conversation, and congratulations on the efforts to have the planetary health strategy. My question is related to that. What is one specific change within government or within Malaysia that you hope the strategy will push for or drive?
I think at the end of the day, most important, political will, it always connects with governance. If we can change the governance and facilitate and make sure there's cross policy, I think that is a big start. right? Because as I see it, we can make, by communication, we can make people aware. We can make people very concerned. But to turn the concern into action requires felicitation from governance as well. So I think if we can, that is a big start for me. But long-term investment is very important in terms of education, mindset change, because that will make a difference to the behavior pattern. Are we going to adopt? Are we going to implement the sustainable practices? We know all about it. I mean, we can read about it, but what is the action that we want to see? What motivates us to change? Is it faith? Is it religion? Is it spirituality? Is it something that we want to do to make a change to the planet? So these kind of things need now to come in. So that will be secondary in action, but it's a long-term investment that needs to be done, but it has to be done. That's what I'm trying to say, is that in all aspects, the governance, the education, and we need to talk to the business people. I mean, you can't have science coming in on its own and then you're not talking to the business people. We need to talk to the politicians. We need to talk to the lawmakers so that they understand why they need to do this, right? And at the end of the day, I think when everything is in place, then we can actually streamline this into policies, and it will be au natural again to have it budget allocation to be there to finance the kind of things that need to be done. What I'm trying to say at the end of the day, you don't have to work so hard to convince people, because people understand this is the way it is, right? So that require probably a disruptive change to behavior that needs to be done, so that now we can probably achieve this planetary health.
Okay, we have a question on Slido here. The Planetary Health National Plan is great, but I'm afraid it will be disjointed from the bigger Malaysian National Development Plan. How will you ensure it sustains in the longer term?
At the end of the day, give us a chance. We haven't even, we are now gathering evidence, because as I say, it has to be evidence-based. So when we start to formulate things, we are already looking at all the existing policies so that we are not disjointed. So, you know, give us a chance, and probably by end of July, we will probably have something to say about this.
Tan Sri Wahid, corporates may be compliant towards national agenda. Greenwashing exists.
Well, yes, they do exist, but my view is actually it's all part of the learning process, right? We talk about sustainability, something new. I think corporates are learning about it at the authorities level, whether it's actually Bandagara, SC, or us at Bursa Malaysia. We provide the guidance and the guidelines, and we will then monitor their compliance. In general, we are seeing good progression. People do want to comply. Some may start by form, box ticking and so on, but I take it as part of a journey. We will continue to engage with them, but deep inside, in all our engagement, we realize that the vast majority of businesses do realize that it is important to embrace sustainability. And planetary health is actually part of the overall context of sustainability, in my view. Thank you.
Okay, quickly, sorry, organizers, I'm just going to address some of these questions. They're suddenly coming in. The youth, what was the Japanese experience? How did you get the youth to be involved in policy making, for an example?
Yes. Yes, as Dr. As mentioned, the education has played a crucial role to move forward about a planetary health approach. And Japan has been addressing the education to the youth and the children about the SDGs target and goals. And my children, who is 13 years old and 9 years old, learned a lot about that and made a presentation to the public or something. So they know much more than me about the SDGs goal. So I think that the planetary health concept could be joined with such kind of educations. And as I presented first, the problem is that each individual is a polluter. So everyone needs to be aware of that. So I think the education would be a good driver for the youth, particularly for youth to think about and make another action that the adults cannot do that. So I'm very looking forward to their power to break in the silos and yes, going well progress about the planetary health approach. Yes.
We're running out of time, Garry. While we make this transition towards planetary health, I call it the great transition. What will be your message? What would you like to leave us with?
Oh, well. We just have to be patient. It's not going to happen overnight. And I'm afraid we are probably only at the very beginning of understanding of this. And also, I also feel that there is no recognition enough for us all that certain things that we'll have to give up. And I don't know, that is not always discussed in an open manner. It's perceived as we can do all of this having had everything that we can now consume. So if we don't think of it that way, and it's a very difficult message, and it depends where you are. It depends where you are in terms of the economic development of a country, etc. But that part is maybe not well, we're not well prepared to deal with that. And what does that mean? And how will we ensure equity in that kind of conversation?
Sacrifices will have to be made, is what you're saying. Dr. Takaki, would you have a message for us?
Yes. I think planetary health is a really important concept because the health is a central concern of human, regardless of the races and nationalities. So tackling to the global environmental problems, planetary health should play a crucial role or central point to cooperate between countries to tackle the same issues. So I'm very looking forward to the further collaboration. On the basis of planetary health approach with you, and thank you so much for this opportunity. I'm really excited. Thank you.
Wahid?
Well, thank you. For me, the case for planetary health is clear. We have gone through COVID and so on, so I don't think people need to be convinced anymore. But the issue mainly is about how do you address it, and making people understand the numbers, the current situation, how to get there, and who's supposed to play what role, and so on. I think it's important. So keep it simple, make people understand, and then sequence it properly. Thank you.
Okay. Prof. Asma, you've got a lot on your shoulders.
Yeah. Keep it simple, make it in sequence. It's going to be a long-term thing. It cannot be changed overnight. Totally agree with all of you. But at the end of the day, I don't think the planet can wait that long for us. So I don't know, as far as I'm concerned, maybe what we need to do is change the KPI for all the ministers in the ministries, right? So that they now know this is very important. Collaboration, 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 communication, communication, communication is very important. So if we can change that KPI, make sure they actually collaborate and make sure we break the silo. So perhaps that will be a fastest way to now make sure all things are in place.
Ladies and gentlemen, our distinguished panel on breaking silos. Thank you very much.